Hello, good evening.
Rabies there.
Yeah, how are you doing? How are you doing?
If you're fine, maybe.
Yeah, I'm also fine. Okay. So last week we finished our discussion on tetanus. I told you the next time we meet, we would start a new topic, which is rabies. So that's what we'll be talking about this evening. I'm sure you read something on it, so hopefully we should have a very interactive discussion. Okay. Is Hillary around?
Yes, please.
Is it okay to start or we should wait?
Please, we can start.
Okay, all right, that's fine. So let's start for rabies. What do you know about rabies, or what did you read about rabies? Anyone to share with us? Anything at all you read about rabies, you can share with us. Hello, is someone talking?
So rabies is a vaccine preventable disease.
Okay, all right. So just like tetanus, rabies is also one of the vaccine preventable diseases. So that's the first thing I want you to know about rabies. It's a vaccine preventable disease, meaning that once you're exposed, you have the opportunity of taking vaccines to prevent the full-blown infection. So that's what we mean by a vaccine preventable disease. You can always take a vaccine once you're exposed to prevent the full-blown infection. The other thing I want you to know about rabies is an infectious disease. Just like tetanus, rabies is also an infectious disease, meaning that it's caused by an infectious pathogen. And this time around, it's not bacteria, but rather a virus. So for tetanus, we were talking about it being caused by a bacteria known as Clostridium tetani. But in rabies, it's caused by a virus. So caused by the rabies virus. That's the virus that causes rabies. All right. The other thing I also want you to know about rabies is it's a notifiable disease. So once you suspect someone has rabies, the appropriate public health unit has to be alerted so that they come in to make sure that the victims are isolated to prevent spread of the infection. So it's a notifiable disease. So just like tetanus as well, this is also a notifiable disease. And the other thing I also want you to know about rabies is that for this infection, it's termed as a zoonotic disease. So when we say a disease is zoonotic, what it means is that this can be transferred from animals to humans. So in terms of the transmission routes, from animals to humans. So that makes it a zoonotic disease. So whenever you hear of zoonotic disease, it means it can be transferred from animals to humans. Can the reverse occur from humans to animals? Can that occur? Do you think an infection can be transferred from humans to animals? No, you don't think so.
It's possible.
Hello? Or someone talking?
Yeah, I was saying it's possible.
Yeah, so you can have the reverse occurring, but it's not in rabies. So whenever you have an infection from humans to animals, it's termed reverse zoonosis, or the other name is anthroponosis. So reverse zoonosis or anthroponosis. So that's from humans to animals. But I think the common examples are COVID-19. You know, when COVID came, if you are infected and you have a pet, you can transfer COVID to the dog or the pet you have. So that was how some of these reverse zoonoses were occurring. The other common example is influenza. Aside COVID, influenza too can be reverse zoonosis from humans to animals. But that's not what we are concerned about. For rabies, we are saying it's a zoonotic disease, meaning that from animals to humans. All right. And in terms of the fatality rate, rabies has the highest human case fatality of any human infections. So it has the highest case fatality rate of any human infectious disease. So what this means is that once you are exposed or once you get rabies, in terms of the fatality, the probability that you die is high. And this probability is approximately 100%. Once you get rabies, you definitely die. There's no two ways about it. So that's how deadly rabies is. It has the highest case fatality rate of any infectious disease. So far, what I've said, rabies is a vaccine preventable disease. Once you're exposed, you can take vaccines to prevent the infection. You also said it's an infectious disease, meaning that it's caused by an infectious pathogen, which is a virus, the rabies virus to be specific. Then we also said it's a notifiable disease. So for a notifiable disease, once someone is suspected as having rabies, the appropriate health authorities have to be notified to come in to help with the disease control and prevent spread. Then we also said it's a zoonotic disease, which means the disease can be transferred from animals to humans. So the transmission route is from animals to humans. And we also said it has the highest case fatality rate of any human infection, and it's approximately 100%. Once you get rabies infection, you are definitely dying. There's no two ways about it. So it has the highest case fatality rate of any infectious disease. HIV, the other disease don't even come close to rabies. It's how deadly, that's how deadly it is. All right. Now let's look at the transmission routes. So we said the rabies infection is transferred from animals to humans. So what are some of the transmission routes? Which animals can potentially transmit rabies to humans?
Dogs and bats.
So we have dogs, we have bats. What again?
Wolves.
Yeah, so wolves. What again?
Raccoons.
Raccoons.
Yeah, raccoons. What again?
Rodents and brown hawk.
Yeah, so you can have some rodents too as well. Okay, what again?
Brown hawk.
So there are a whole lot of animals that can potentially transmit rabies to animals, to humans. Just that the ones we've domesticated in our homes. So no one will bring a lion to their house or a wolf, a fox to their house. All these can transmit rabies. But the ones we've domesticated, like dogs, cats, these are very common transmission routes to humans. But if you are caught up in the forest or some wild area, then you can get bitten by foxes, raccoons, jackals, wolves. All these can potentially transmit rabies. So it's usually the canine family and the feline family. So the canine family, where you have the dogs, the wolves, the foxes, you have a lot of rabies transmission. The feline family, where you have the cats and the big cats, like the cheetahs, the lion, all of these can transmit rabies. And some of these rodents can also transmit rabies. So it's very important we know some of these animal transmission routes so that if you are bitten by any of these, you know that you have to go for rabies vaccination. Else, if you don't go and you get a rabies infection, you know that the fatality rate is 100%. You are definitely dying. So it's very important. All right, now let's skew our attention to the rabies virus. So the rabies virus. So basically, for viruses, you would have to know their family, their genus, and the species. So we said the organism that causes rabies is the rabies virus. So which family does it belong to? What's the family of the rabies virus?
Yeah, Rhabdoviridae.
Anyone?
Rhabdoviridae.
Yeah, so the family is Rhabdoviridae. So Rhabdoviridae. So that's the family of the rabies virus. What about the genus?
Lyssa virus.
What about the genus?
Lyssa virus.
Yeah, so the genus is Lyssa virus. So Rhabdoviridae is the family. The genus is Lysa virus. And the species is basically the rhabdovirus or the rabies virus. So this is something you should know in terms of the taxonomy. So you should know the family, you should know the genus. All right. Now, basically, the rhabdovirus or the rabies virus is an RNA virus. So you know viruses, we have RNA viruses, we have DNA viruses. So rhabdovirus or the rabies virus is an RNA virus. And this RNA virus is made up of a nucleocapsid core and a lipoprotein envelope. So the rabies virus we are saying is an RNA virus, single-stranded RNA virus. Capsid core is the lipoprotein envelope. So take note of the parts of the virus. So a nucleocapsid core. So basically, the nucleocapsid core is where you find the nucleus and other nuclear materials, whereas the surrounding membrane, which is the envelope, is a lipoprotein envelope. So the virus is said to be shaped like a bullet. So the shape of the virus is bullet shaped. So it's a bullet shaped virus. And we are saying that it's very easy to kill the virus. The virus is easily inactivated by, you can inactivate them by using detergents. So one of the first thing that we recommend when you are bitten by a dog or bitten by any of these animals, we'll tell you to wash the area with soap and water. It's because the virus can easily be inactivated by detergents. They can also be inactivated by radiations like X-ray, UV radiation. Radiations like X-ray and UV radiations also inactivate the virus. You could also inactivate by drying. So drying also inactivates the virus. So you do realize that when you are bitten, the route of transmission is basically saliva exposure. The virus is found in the saliva of these animals we've talked about. So it's from saliva exposure to a wound. So if you wash the wound thoroughly and you make it, you allow it to dry, the drying process can easily inactivate the virus. So drying is also one of them. Then you can also use antiseptics like ethanol and ether. So ethanol, which is alcohol, then ether. All these can easily inactivate the virus. So it's very easy to inactivate the virus. Yeah. Then I also mentioned the nucleocapsid. I said it contains some nuclear materials. One of the things that is important to note is the presence of nigri bodies. So there are these cytocronclusions known as nigri bodies. We'll talk about that more in the diagnosis. But right now, I want you to take note that within the nucleocapsid core, there are these materials known as nigri bodies. And this is used in the diagnosis. It's one of the things that are used in the diagnosis. So take note of it. Any questions so far? Or can we move on? Yeah. So one of the other things I didn't mention is that.
Please, did you
A
say the
moment.
nigri bodies are in the nucleocapsid core?
Yeah, they are in the nucleocapsid core.
Okay, thank you.
Okay. So the virus is also inactivated by very low temperatures. So if you expose the virus to low temperatures, it can easily inactivate the virus. So that's also one of the things that can easily inactivate the virus. And this is the more reason why rabies can be found in all the continents in this world, except one continent. Who can tell me that continent where you can't find rabies? Almost all the continents, Africa, everywhere, you find rabies except one continent. Anyone? Oh, so of all the continents, which one has the lowest temperature or is the coldest?
Antarctica.
Yeah,
Antarctica.
Antarctica. Antarctica. So in terms of, yeah, so except Antarctica. Antarctica is the only continent you don't find rabies. Those who are close to the equator because of the sun, high temperature tend to have a lot of rabies virus in the tropics, subtropics. But in the temperate regions like Antarctica, very low temperatures, you are unlikely to find the rabies virus. So that's the only continent you can find rabies virus. And it's the more reason why of all the animals that can transmit rabies, opossum has the least risk of transmission because this animal is found in these regions, the Antarctica, very low temperatures. So opossum has the lowest transmission risk for rabies because it's found in these very low temperatures. Any questions so far? All right, so now let's move on to the pathogenesis. So the pathogenesis, how the rabies virus gets into the body, how it's able to cause the signs and symptoms we'll see later on. So let's talk about the pathogenesis of the rabies virus. All right, so basically it starts with an exposure. And this exposure, we are saying that it can come in the form of a bite from an animal, or it can come as a result of maybe a wound contaminated by the saliva of these animals. So if you have an open wound or mucous membrane in contact with the saliva, or you get a bite or a scratch from these animals, that's how the exposure occurs. So you're either being bitten, you're either having a scratch, or you have an open wound or mucous membrane like your mouth, it could be your mouth or any of your mucous membrane, your eyes getting exposed to the saliva of these animals. So that's how the exposure occurs. So once the organism is able to be, or the virus is inoculated in the body, what happens is under favorable conditions, the virus is able to travel along the nerves to the CNS. So once it's inoculated into the system, the first thing that happens is it first hides itself within the peripheral nerves. And by hiding itself within the peripheral nerves, is trying to evade immune surveillance. So what we are saying is that this virus, once it's inoculated in the system, it doesn't go through the blood. So if it's in the blood, the immune system can easily detect it. Antibodies will be produced against it. But once it hides itself within the nerves, the immune surveillance is not able to detect it. So one of the properties of the rabies virus is we say is a neurotropic virus. Neurotropic virus. It loves the nerves and is able to travel along the nerves. So that's one property of the rabies virus. It's a neurotropic virus. So we are saying exposure can come in the form of a bite, a scratch, saliva exposure on an open wound or mucous membrane, or you can have these aerosols, even aerosols in the lab. If you are working in the lab with the rabies virus, aerosols, you can inhale them and you can also be exposed. So all these are the routes of exposure. And we are saying once you are exposed and the virus gets into the system, the virus is able to hide itself within the peripheral nerves. And by hiding itself within the peripheral nerves, it's trying to evade immune surveillance so that the immune system cannot detect it. We are also saying that upon favorable conditions, we are saying the virus is able to travel along the peripheral nerves to the CNS. So maybe you're bitten around the leg, the virus will be inoculated around the area of exposure. It will hide itself within the peripheral nerves there just to evade immune surveillance. And we are saying that under favorable conditions, it can travel along the nerves. So what happens is that before the traveling along the nerves occur, there's a prolonged incubation period of about 1 to 3 months that follows. So the incubation period is 1 to 3 months. Other reference talk about 20 to 90 days. So that's the incubation period of the rabies virus. So we said when it's inoculated into the system, it's able to hide itself from immune surveillance by sequestering itself around the nest. Once it's there, a prolonged incubation period follows. And this incubation period, we are saying, ranges from 1 to 3 months or 20 to 90 days. The incubation period, which is the 1 to 3 months, depends on two main things. So it depends on the size of inoculum and also the proximity to the CNS. So if you are bitten by a dog, maybe at just one side of your body, and someone is bitten multiple times, so there's a bite around the bitten. So looking at that, in terms of the inoculum size, inoculum is basically, we are looking at the saliva that has been introduced or the amount of viral particles in the saliva that has been introduced. So that's the inoculum size. So if you compare someone who has had multiple bites to someone with a single bite, in terms of the inoculum size, it will be higher in the multiple bites compared to the single bite. So that's the inoculum size. So once the inoculum size is high, the incubation period is also shorter. So instead of the 1 to 3 months, it may take just 1 month for you to start showing symptoms. But if the patient had maybe a single bite, the inoculum size is relatively smaller compared to the multiple bites. So in terms of the incubation period, it may be more prolonged in the single bite. Then we are also talking about proximity to the CNS. We said the rabies virus is a neurotropic virus, so it allows the CNS, travels along the peripheral nerves to the CNS. So if you compare someone who was bitten around the neck, someone who was bitten on the foot, in terms of proximity to the CNS, the one who was bitten around the neck is closer to the CNS, basically the brain and the spinal cord. Whereas the one who was bitten on the leg, in terms of proximity wise, the distance is long. So for you to start showing signs and symptoms, the one that was bitten around the neck will be faster. So the incubation period will be shorter. So it may take like 20 days. Sometimes even the incubation period may be shorter. So what we've given as the value is the average. So the 1 to 3 months or 20 to 90 days is the average incubation period. So you can have the extremes. It can be shorter or it can be longer, but that's the average. So basically, we are saying that once the virus is inoculated into the system, it's able to sequester itself within the peripheral nerves and this helps to evade the immune surveillance. Once it's there, a long or prolonged incubation period follows, which is 1 to 3 months or 20 to 90 days. And we are saying the incubation period is dependent on the size of the inoculum and proximity to the CNS. All right. So after the incubation period, the virus begins to travel at a very fast rate, so from the peripheral nerves to the CNS. And the virus, once it gets to the spinal cord, around the spinal ganglion. So now the virus has traveled from the peripheral nerves to the spinal cord. At the spinal cord, there's this structure we call the spinal ganglion. Spinal ganglion basically is a collection of neurons at the spinal cord. So you have a collection of neurons. So that's the ganglion. We said the virus is neurotropic, so it loves these nerves. So it's basically going to infect the spinal ganglion. So when it gets to the spinal ganglion, that is where amplification and replication occurs. So when we talk about amplification and replication, basically the virus is trying to make more copies of itself. So once it gets to the spinal ganglion, that's where amplification and replication of the viral particles occur. And at this juncture, you can give all the prophylactic anti-rabies in this world. The patient will still die. Because around this time, every anti-rabies you give will be futile. It wouldn't be able to eradicate the rabies virus because replication has occurred and more viral copies have been made. So in terms of fatality, this is where the patient is likely to die because the anti-rabies that you'll be given wouldn't be able to eradicate the organism. All right. So take note that just like tetanus, they said the tetanus specimen is able to travel along the nerves to the CNS. And this type of transport is what we term the retrograde axonal transport because it's traveling backwards from the peripheral nerves to the CNS. The same thing occurs with rabies. So the rabies virus travel along the nerves by a retrograde axonal transport to the spinal ganglion. So it's traveling backwards to the CNS. And we are saying that once it gets to the spinal ganglion, that's where replication and multiplication of the viral particles occur. So at this point, any anti-rabies you give will remain futile, wouldn't be able to eradicate the organism. All All right. So from this point, that is where the patient will start showing signs and symptoms. So at the spinal ganglion, where the amplification and replication occurs, this is where the patient will start showing signs and symptoms. And usually the first sign they show is pain and paresthesia at the site of exposure. So if you are bitten by a dog, you may have initial pain. Maybe initially you were able to treat the wound and all that, the pain resolved. But once it gets to the spinal ganglion, you realize that you start feeling pain all over again. And then you also have paresthesia, that tingling sensation around the site of exposure. So these are the first signs and symptoms that occur. And once you have this occurring, the patient is said to have rabies because these are the hallmark findings of rabies. The pain and paresthesia at the site of exposure. They are usually the hallmark findings of rabies. Once you start having that, then you know you have rabies and you are going to die. There are no two ways about it. All right. So from the spinal ganglion, the virus is able to travel very quickly to the CNS. So it travels quickly to the CNS, gets to the brain, and cause a rapidly progressive encephalitis. So now from the spinal ganglion, travels straight to the brain at a very fast rate to cause what we call the rapidly progressive encephalitis. When we say encephalitis, basically it's the inflammation of the brain parenchyma. So the virus will travel to the brain to cause inflammation of the brain parenchyma. So that's encephalitis. So from there, the virus will travel from the brain to the periphery. So now it traveled backwards, which was retrograde. It will now be traveling forward, so anterograde. So from the brain back to the salivary gland into the periphery. So that's how the transport occurs. So from the peripheral nerves to the spinal ganglion to the CNS. Then once it causes the encephalitis, it travels forward. So from the brain, it travels to the salivary gland. So now the virus will be in the saliva such that if you are bitten by a dog, you know that once the saliva touches the wound, the saliva contains the viral particles, so it can easily be infected. So it travels to the salivary gland and the periphery. So it goes to the other peripheral nerves to cause signs and symptoms. So that's the trajectory of events. What happens in rabies? Any questions?
Yes, please. So, please, with this being said, are there instances where a human to human transmission is possible, or such cases are rare?
Yeah, so there's there's this possibility that humans can potentially transmit to other humans, especially when you have saliva exposure, because the virus basically end up in the saliva. So if you are bitten by someone who is infected with rabies, because of the saliva, you can also be infected. But this is a very rare transmission route. We've not had a lot of cases from this. The only documented cases of these human-to-human transmission are people who receive transplantation of neurologic tissues. So if there was transplantation from someone who had rabies to someone who didn't have rabies of any of their neurologic tissues. So there is a documented history of cornea transplant So there was transplant of cornea from someone infected to someone who wasn't infected. And the patients developed rabies from that. So that's a route by transplantation. But as to having transmission via bites, it's not been documented because it's highly unlikely that someone infected with rabies will bite you. Uh, So that's the issue with human to human. It's very rare, but it can occur. Any other questions? All right, so let's move on. Let's talk about the clinical manifestations of rabies. So the clinical manifestation of rabies. So for the clinical manifestation, before we even start, once the person exhibits clinical signs and symptoms, then we know that definitely the person is going to die. So once they show signs and symptoms, then we know that that person is going to die. So if you are trying to diagnose someone as having rabies and you are waiting for the patient to show signs and symptoms before you say this person has rabies, definitely that person is going to die. You can't help the patient. So you don't wait for the person to show signs and symptoms. If you're exposed, you start taking the vaccine. That's why it's a vaccine preventable disease. Once you're exposed, you start taking the vaccine to prevent the disease. Because once the disease starts, there's no coming back. Hello.
Hello, sir.
Hello.
Yeah. So I was talking about the clinical manifestation. I said that once the person starts showing signs and symptoms, definitely they are going to die. So if you are trying to diagnose someone as having rabies, and you are waiting for signs and symptoms, know that that person is dying. There's no two ways about it. So the clinical manifestations, I'll talk about this based on the stages. So you have clinical stages of rabies, and each clinical stage presents with its own signs and symptoms. So we talk about the signs and symptoms based on the clinical stages of rabies. So the first stage is the incubation period. So the incubation period is the first, followed by the prodromal stage or the prodromal period. Then we also have the acute neurologic stage. The acute neurologic stage. Then the first one is the coma stage. Coma. So the coma stage. And the last one is death. So the last is death. So we have 5 stages: the incubation period, the prodromal stage, the acute neurologic stage, the coma stage, and the last stage is death. So these are the 5 clinical stages of rabies. So we'll talk about that one after the other. So within 1 to 3 months of being exposed, you are asymptomatic. So you wouldn't show signs and symptoms, and be you wouldn't have any signs and symptoms that will show that you have the rabies. So you have the opportunity to go for a vaccine around this time. So you have about 3 months to go and take the vaccine. But we also said that the incubation period, even though it's 1 to 3 months, it depends on two things: the size of the inoculum and proximity to the CNS. So it can be shorter than 1 month, or it can take longer than the 3 months. But the average is 1 to 3 months. And we are saying it's dependent on the size of the inoculum. So if you had more inoculum being introduced, it could be lesser than the 1 month, or it should be around 1 month. Then if you had a bite around the neck, the head, that is very close to the CNS. So the virus wouldn't have to travel a long distance to get to the brain for the signs and symptoms to occur. So it's just a short distance. So within even a week or two, you can start showing signs and symptoms. So the earlier, the better. Once you're exposed, the earlier you take the vaccine, the better. Because once the signs and symptoms kick in, you are definitely dying. All right. The next stage is the prodromal stage. So the prodromal stage. So the incubation period is where the virus is able to segregate itself at the peripheral nerves to evade immune surveillance. So once it's there, the incubation period follows. So now the prodromal stage, basically it is around this stage the patient will start showing non-specific signs and symptoms. So there will be presence of non-specific signs and symptoms. And some of these non-specific signs and symptoms are fever. Patient may have fever. There can be nausea and vomiting. There can be chills. The patient may also present with malaise, the feeling of unwell, malaise. There could also be anorexia and sore throat. So basically, for this stage, we are saying the patient will present with non-specific signs and symptoms, because around this time, the virus hasn't shown full-blown infection. So you may start feeling unwell, but this doesn't really point to the rabies, because if you are talking about fever, chills, malaise, someone with fatigue, the first thing you may think of is, oh, maybe the person has malaria. So you may treat malaria thinking that it's malaria. You treat malaria, it doesn't go, then you're suspecting. Is it maybe typhoid or any infection? You go and treat typhoid, or you give antibiotics, and still the signs and symptoms are present. You may not suspect rabies, because these are conventional signs and symptoms you can have in a lot of conditions. So they may mimic other infectious conditions like malaria, typhoid, and you end up not suspecting that it's rabies. So that's the prodromal stage. And usually this stage lasts for about 2 to 10 days. So 2 to 10 days. The duration for the prodromal stage is usually 2 to 10 days. And if you remember, when I was talking about the pathogenesis, I talked about the fact that once the virus reaches the spinal ganglion, the patient may start having pain and paresthesia at the site of exposure. So at the prodromal stage, you may have pain and paraesthesia at the site. And this is the pathognomonic sign of rabies, or the hallmark finding of rabies, the pain and paraesthesia at the site of exposure. So this also occurs in the prodromal stage. And we said once these kick in, you can give all the anti-rabies in this world. The patient will definitely die, because around this time, any prophylactic anti-rabies will prove futile, wouldn't be able to work. So it's around the incubation period that you can give all the vaccines in this world. But once you get to the prodromal stage, where the signs and symptoms kick in, you can't do anything. The patient will definitely die. So that's the prodromal stage. The next stage is the acute neurologic stage. The acute neurologic stage. Basically, this stage is known as the clinical rabies, or is referred to as clinical rabies, because this is where you see actual signs and symptoms of rabies. The prodromal stage, you are seeing non-specific signs and symptoms. But acute neurologic stage, that is where you see the typical signs and symptoms of rabies. So it's also known as the clinical rabies stage. All right. So basically, this stage is divided into two. So we have some patients presenting with furious rabies. So it could either be furious rabies or damp rabies. So that is how the acute neurologic stage is. So you could either have furious, so furious, someone is furious, past and furious, so furious rabies. Whilst the other stage is damp, so damp rabies. So damp. So furious rabies or damp rabies. So that's how it can present in the acute neurologic state. So we'll talk about them one after the other. So for the first one, which is furious rabies. The other name for furious rabies is encephalitic rabies. It's also referred to as encephalitic rabies or frantic rabies. These are the other names of the furious rabies. So encephalitic rabies or frantic. Encephalitic rabies or frantic rabies. So that's the furious rabies. Whereas the damp rabies is also known as the paralytic rabies. The other name for damp rabies is paralytic rabies or apathetic rabies. So paralytic rabies or apathetic rabies. I've typed them in the chat box, so if you can't get the spelling, it's there. So furious rabies, also known as frantic rabies or the encephalitic rabies, whereas the damp rabies, also known as paralytic rabies or apathetic rabies. So let's talk about them one after the other. So for the acute neurologic stage, usually it lasts for 2 to 7 days. So the duration for the acute neurologic stage is 2 to 7 days. So let's take the first one, the furious rabies. From the name, furious. So the patient will be aggressive. Around this time,
Sir,
the
please, what you
patient
say
will be
about the
very.
2 to 7 days? I missed it.
You said?
Sir, please, what did you say about the 2 to 7 days? I missed that one.
I said the acute neurologic stage, the duration is 2 to 7 days.
Okay, thank you.
Okay. So for the furious rabies or encephalitic rabies, from the name, the patient will be what? furious, aggressive. So the classical presentation is there will be hyperactivity or aggression. So you have hyperactivity or aggression around this stage. The patient may also present with fever. So you may have fever. And you could also have these two classical signs and symptoms, hydrophobia and aerophobia. Hydrophobia. So phobia, phobia, fear. So hydrophobia, fear of water, whereas aerophobia, fear of air. So they'll fear too much air. Aerophobia. So aerophobia, hydrophobia. So basically, we are saying that for the furious rabies, it's characterized by hyperactivity and aggression. You may have fever. You may have hydrophobia, so fear of water. So around this time, if you take water close to the one infected, they may start backtracking or they may start showing some aggressive behavior. So they fear water. And when you expose them to too much air, they also fear. So if you start getting those signals, then you know that the patient is having furious rabies. So that's the classical signs of the furious rabies, the aerophobia and hydrophobia. Then you could also have pharyngeal spasms. So pharyngeal spasms around the pharynx. And that is even the more reason why they fear water. Because when you take water close to them and they attempt to drink the water, they start getting very painful spasms around the pharynx. So that accounts for some of the reasons why they fear water. So
Can you take that again?
For the furious rabies,
Please, can you take that
it
again?
accounts for 80% of the cases. So for the acute neurology stage, we said we could have furious
Hello.
rabies or damp rabies. Hello.
Yes, Dr. Ishak, please, someone wanted you to take the pharyngeal spasms part again.
Yeah, so the pharyngeal spasms, I said, usually for someone infected with rabies, one of the things that makes them fear water is that whenever they try drinking water, you take water close to them and they attempt to drink, they start to get these very painful spasms around the pharynx. And that is one of the reasons why they fear water. And I don't know if this is a myth or something, but I'm sure you've heard of the news that if you are bitten by a rabid dog, you start also barking like a dog. I'm sure you've heard of that statement before.
Yes,
But it's
please.
usually regarded as a myth because what actually happens is that it's not because they are barking like a dog, but because once they are infected with rabies, they start to get these spasms around the pharynx and the larynx, the voice box. So they start to produce certain sound that seem like they are barking like a dog. But it's not like they are actually barking like a dog, but because of the spasm that is occurring around the pharynx and the voice box, that is causing those sounds to appear as if they are sparking and they are barking like a dog. So that's the explanation for the pharyngeal spasm. All right. So I was also saying that the previous rabies accounts for 80% of the acute neurologic stage. So the acute neurologic stage, it could either be previous rabies or damp rabies. Between the two, 80% of the cases are previous. Just 20% are damp rabies. So most of them would present as previous rabies. So that's why even dogs, when they are infected, they appear to be aggressive. So because 80% of them presents as previous rabies. All right, let's look at the paralytic rabies. So for paralytic rabies or the damp rabies, from the name, this is characterized by paralysis. And this paralysis is not just any paralysis, but ascending paralysis. So the paralysis starts from the lower limbs and progresses to the upper limbs.
Hello,
So
sir.
there's an
Please, can you
ascending
start?
paralysis. So it starts from the lower limbs and travels to
Hello,
the
sir.
upper limb. Hello.
Sir, please, can you start again? Sorry, for the damp rabies.
So I'm saying that it's characterized by ascending paralysis. So the patient starts having paralysis from the lower limbs and it travels upwards to the upper limbs. And we are saying this accounts for 20% of the acute neurologic stage. So 20% of acute neurologic stage is the paralytic or damp rabies. And this can usually mimic another condition that presents with ascending paralysis. So there's this condition we call the Guillain-Barré syndrome. So the Guillain-Barré syndrome. So that also presents as ascending paralysis. So if you don't take care, you may think you are managing a possible case of Guillain-Barré syndrome. Meanwhile, it could be paralytic rabies that the patient has. So always consider a possible differential diagnosis. When you see ascending rabies, think of rabies, think of Guillain-Barré syndrome, because they usually present similarly to ascending paralysis. The other thing that also happens in paralytic rabies is usually they lose their deep tendon reflexes. So when you want to check reflexes, you realize that for these patients, if you hit them with a patella hammer, maybe around the patella, you want to check whether there are reflexes. You hit the place with the patella hammer and you don't see any reflex because they lose their deep tendon reflexes. So that is also one of the classical signs. So you can check for reflexes around the plantar, around the patella. So they may lose these reflexes. Once you see that, you know that you are dealing with a damp rabies or paralytic rabies. Any questions?
Yeah, sir, please. I don't know
All
if
right.
I heard right, but I thought I heard the is there 20% for both the furious and the damp? Because I thought I heard 20% when you were talking about the furious rabies too.
I said furious is 80%, then damp is 20%. So the acute neurologic stage, furious rabies forms 80%, while the damp rabies forms 20%.
Yes, please. Thank you.
All right, so let's move on to the coma stage. So the coma stage. So basically, when we say coma, the patient will lose consciousness. So at this stage, the patient loses consciousness. And this stage may, in terms of the duration, it differs. Mm. So you don't have a fixed number of days that the patient will go into coma. So it differs. So you don't have a fixed number of days the patient will go into coma. Just that what happens is within 10 days of acute neurologic period, the patient can go into coma. So we said the acute neurologic period takes 2 to 7 days. So right after, the patient will go into coma. So within 10 days of onset of the acute neurologic period, the patient will go into coma. Just that the duration for the coma stage varies. So you don't have a fixed number of days the patient goes into coma. So the characteristic finding is once the patient loses consciousness, then the patient is in the coma stage. So right after coma is the last stage, which is death. So death is the last and final destination. So the final destination of rabies is death. So at this point, you can't do anything about it. So if there's no adequate supportive care when the patient goes into coma, there's no ventilator, there's no adequate supportive care, patient is definitely going to die. So that's the last stage of the rabies. So the 5 stages: incubation, prodromal, acute neurologic, coma, and death stage. Any questions? All right, so now let's talk about the diagnosis. Let's move on to talk about the diagnosis. So for the diagnosis, for every diagnosis, we want to start with history. History is the first thing you want to start with. You want to know the history, what happened. You want to be sure that you are dealing with a possible case of rabies. So history is very important. So in the history taking, there are 4 key questions you always want to ask the patient. And these 4 key questions, one of them is you want to find out the nature of interaction with the animal. What was the nature of interaction with the animal? So they can tell you, oh, maybe I was playing with a dog and the dog bit me. So in terms of the nature of interaction, there was a bite. You could have another patient presenting with maybe a scratch. So that is the nature of interaction. Could be been some changes in the behavior. Maybe you have been feeding the dog. When you take food to the dog eats almost every time. All of a sudden, the dog has stopped eating. It doesn't eat anything. So that's an abnormal behavior. You go close to the dog, your own dog, and it's barking at you. That's an abnormal behavior. It doesn't recognize you again. So all these are abnormal behavior. You can see some hypersalivation. Like it's not the usual salivation from a dog. This is hypersalivation. All these are unusual behavior in the animal. Then you also want to find out the vaccination status of the animal. You want to be sure whether the animal has been vaccinated. If it's been vaccinated, is it up to date? The vaccination status, is it up to date? And you also want to find out the availability of the animal for testing. So the availability of the animal for testing. So if it's your own dog, can it be captured so that the veterinary people will test for rabies in the dog? If or is it a stray animal? You were just walking by and you had a stray animal coming to bite you. That one, definitely you can't capture the animal. Like if you're able to kill the animal, then it's available for testing. If you are not able to kill the animal, is it your own pet that we can capture? If it can be captured, what can be done? Is it a stray animal? So the availability of the animal for testing is very important. So these are the 4 key questions you want to take during the history. The nature of interaction with the animal, any strange behavior in the animal, especially if you see a nocturnal animal behaving like diurnal. The normal thing is for something like a bat. Bats are nocturnal. They are active during the night. During the day, they are supposed to be hibernating, but during the night, that's when they are active. So if you see a bat flying around in the morning, in the afternoon, being active during the day, then it's a potentially rabid bat. It's a potentially rabid bat because it's a nocturnal animal behaving as diurnal. So that's an abnormal behavior. Then you also want to find out the vaccination status. Has the animal been vaccinated? If it's been vaccinated, is it up to date? And the availability of the animal for testing, whether it can be captured, is it a stray animal, has it been killed? So all these are very important in the history. So if it happens to be maybe a dog that can be captured, the recommendation from the veterinary people is that you would have to observe for signs and symptoms in the dog for 10 days. So they capture the dog, the vet people capture the dog, and they observe for signs and symptoms in the dog for 10 days. So within 10 days, they are trying to find signs and symptoms in the dog, any abnormal behavior. Is there any hypersalivation? Is there anything that is pointing to rabies? If within the 10-day period of quarantine, the dog dies, within 10-day period of the quarantine, then definitely well the dog is rabid. So if the dog is rabid, it will definitely die within 10 days of quarantining the dog. However, if the dog is not rabid, it will survive after 10 days. If after 10 days the dog survives it, then that the dog is not rabid. But if it dies within 10 days of quarantine, then the dog is rabid. Around this time, the patient has already started the anti-rabies prophylaxis. So you start the prophylaxis even when they are quarantining the dog because there's no time to waste. When the person, starts showing signs and symptoms, you are definitely dying. So you don't wait. You start the anti-rabies vaccination. If the dog dies within the 10 days, definitely the dog is rabid. So you have to continue the full course of the anti-rabies vaccination. However, if the dog does not die after 10 days, there is no need to continue the full course of the anti-rabies. So instead of doing treatment, you just do a prophylaxis. You may have taken 3 doses, and that's enough for prophylaxis. But if the dog dies within 10 days, the dog is rabid, you have to continue the regimen for the whole 1 month. So that's how we go about the diagnosing for rabies in the live animal. This is a live animal, the live animal. So we check for signs and symptoms within 10 days of quarantine. If they start showing signs and symptoms, and the dog also dies within 10 days, it's rabies. But if it survives after 10 days, it's not rabies. Uh-huh. The other thing is,
Sir, please I have a
if
question.
okay, all right.
Okay, from what you are saying, with respect to the incubation period being the 1 to 3 months, what if the dog has it but hasn't yet started showing any signs and symptoms? Because I feel that 10 days is too small considering the incubation period. So how can you use that to determine?
So what we talked about is the incubation period in humans. Yeah. And all the things we've been talking about is in humans. For the dog wouldn't start showing signs of rabies until the virus has gotten to the saliva. So that's the acute neurologic stage. When the dog becomes very aggressive and they start biting people. The dog is already at the acute neurologic stage. And the acute neurologic stage is 2 to 7 days. The duration is 2 to 7 days. And the dog doesn't go into the coma stage like humans. So from their acute neurologic stage, the next stage is death for them. And the acute neurologic stage lasts for 2 to 7 days. So within 10 days, the dog should be dead if they are actually rabid, because at the time they beat you, they are already in the acute neurologic stage where they are showing aggressive behavior and the virus is in the saliva. But if they survive after 10 days, then you know definitely they are not rabid. Is that
Yes, sir.
clear?
Thank you. Yeah.
Okay. So I was talking about this for the live animal. So if it so happens that maybe you fought with the dog, you're able to kill the dog, or the dog didn't die, but you as the owner, you want to kill the dog because of what it did to you, that can also be done. So basically, for the vet people, the recommendation is that once the dog dies or you want to kill the dog, because the only way they can actually test for rabies in the dog is when the dog is dead. When the dog is alive, they wouldn't be able to check for like confirm rabies. They can only quarantine and look for signs and symptoms to see whether the dog will die within 10 days and all that. But if you really want to confirm whether the dog has the rabies virus, you can only confirm by killing the dog. Because the rabies virus, remember we said, is a neurotropic virus. And this neurotropic virus, it can only be found before you can diagnose it. You'd have to cut the head of the dog. So what happens is that the vet people, their recommendation is once you're able to kill the dog, you cut off the head of the dog and you refrigerate the head. So you keep it in fridge and you ship it overnight to the vet people so that they can check for the presence of the rabies virus in the brain. So when it gets to them, they open up the brain of the dog, and basically what they want to check is the presence of nigri bodies in the brain of the dog. So they go into the brain, around the brain stem. That is where they usually take samples. So they take samples from the brain stem and they do immunofluorescence staining for the presence of viral antigens and nigri bodies. So if they see nigri bodies in the brain and they also see the viral antigens, they do immunofluorescence staining for the presence of viral antigens. If they see this, the dog is rabid. So once they see this, you know definitely the dog is rabid. So you have to go ahead with your vaccination. But if they cut off the head and they check for the presence of nuclear bodies, viral antigens, and they don't find anything, the dog is not rabid. So they have just killed the dog for nothing. So they usually advise that you quarantine them, you quarantine the dog for 10 days, and we check for signs and symptoms. But if it so happens that you were able to kill the dog in the process, then you cut off the head, keep it in fridge, ship it overnight to them. Then they would check for the presence of nuclear bodies and viral antigens in the in the brainstem. So that is how you can actually confirm rabies in the dog. You can't confirm rabies in the live animal. You can only confirm when you kill and open up the brain. So that is why the quarantine is recommended. All right. Any questions? Okay. So for tetanus, for rabies, the diagnosis for rabies is basically the history and the quarantine to see whether they die within 10 days or they survive after 10 days. Or if you have the dead animal, they can do post-mortem testing of the brain for the nuclear bodies and viral antigens. So that's how it's diagnosed. You don't wait to diagnose rabies in the human. If you are waiting for the aerophobia, hydrophobia, the hypersalivation, the paralysis in the human, definitely that person is dying. So even though we went through the clinical signs and symptoms using the acute neurologic stage and all that, you don't wait for those things because once it occurs, the patient is dying. So the only thing is you are just looking at the dog and you've started the human on prophylaxis anti-rabies. If it so happens the dog is not rabid, you stop the prophylaxis. If it happens that the dog is rabid, you continue for the full treatment. All right. Any questions?
Dr. Jacques, please, in a case where they would an individual would want to get the dog killed and actually test for rabies rather than observing the dog, if what precautions or counseling would you give to a layman who would kill the dog and store the head of the dog overnight, considering the fact that it's transmitted via the saliva of the dog? What precautions are there to be adhered to?
Yeah, so basically, if you are bitten by the dog, that means you don't really have control. So it's better that you invite the vet people or the animal control officers. I don't know if in Ghana here we have animal control officers, but maybe the vet people may have specialized people that can help with that. You don't want to get their saliva being exposed to your wounds, especially where you got bitten. Already, their saliva may have been there. You washed with soap and water, but you don't want more inoculum to get there. So if you can't capture and kill the dog, you just invite them to come over to help with that. But other than that, if you can stay away from the dog, observe for the signs and symptoms for 10 days. If the dog survives after 10 days, then you know definitely there's no need killing the dog because the dog is not rabid. But if within 10 days the dog is rabid, the dog will even die by a natural death. So you don't really have to go in and kill the dog. So all these are some of the things you can take note of.
Yes, please. Thank you.
Okay. Any other question?
Hello,
Okay.
Doc.
Yeah.
Yeah, so please, in situations where the dog is actively vaccinated, are you still, and you still have your doubts, are you still going to go through the whole process of quarantine?
Yeah, so you still have to quarantine because you don't know it can be vaccinated, but definitely some of these vaccination you have to do booster doses. So if a dog may have been vaccinated previously but hasn't received the necessary booster doses to help with enough titer antibodies that will prevent rabies, the dog can still be infected. So you want to be sure. So it's better to be careful than to be sorry, right? So you still want to observe them and the human being, start your prophylaxis. If it so happens they are not rabid, after 10 days, you can stop. Okay. Any more questions? All right. So if there are no more questions, I think we would end here for today. Hopefully, the next time we meet, we'll go through the treatment. Then we also do some questions on rabies. So hopefully, the next time, that's what we'll go through. Any more questions before we end? Okay. In the absence of any questions, hopefully next week. Have a good evening.